Good evening and welcome to Vietnam News, where East meets West. I'm Peter, and here are tonight's top stories. We begin in Da Nang, where a truck driver has been arrested after crashing into a busy market, leaving 3 people dead and several injured. In Ho Chi Minh City, a Taiwanese restaurant boss has been indicted for running a prostitution brokerage for foreigners. And just outside the city's hospitals, street vendors continue to flood the sidewalks, raising safety and congestion concerns. On the health front, the Ministry of Health has launched a national action plan to support more than 6 million Vietnamese living with rare diseases. Meanwhile, public health officials in Can Tho are warning of a surge in dengue fever cases this September. And finally, we take a look at the closing of Red Lantern, a beloved Vietnamese restaurant in Australia that has served authentic dishes for more than 2 decades. All that and more, coming up tonight. Here's Scott with the news.
We begin in the Central Highlands, where a tragic crash has left 3 people dead, a community shaken, and renewed concerns over Vietnam's road safety. This is the aftermath of a tragic crash that unfolded at a local market in Dak Nong province. Let's break down what happened, why it matters, and what it could mean going forward. On Wednesday morning, a truck driver lost control of his vehicle while approaching a market in the Central Highlands. The truck plowed directly into a group of people shopping and selling goods, killing 3 individuals instantly and injuring several others. The driver was arrested on the spot, and authorities are now investigating the circumstances that led to the crash. While the story itself is devastating, it also shines a light on an issue that isn't new to Vietnam: the ongoing battle with traffic safety. Markets in many parts of the country, especially rural or semi-urban areas, are often located right along main roads. They're lively community hubs, but their proximity to heavy traffic can make them incredibly vulnerable. This crash is a tragic reminder of just how quickly routine daily life can turn into disaster. To put this in perspective, Vietnam has been working for years to reduce traffic-related fatalities, but progress has been uneven. According to official reports, thousands of people still die in road accidents every year, with speeding, poor vehicle maintenance, and driver fatigue listed among the major causes. The government has introduced stricter penalties and more checkpoints, but incidents like this one show how much more needs to be done, particularly when it comes to high-risk areas like roadside markets. For locals, this isn't just another statistic. Markets aren't only places to shop. They're where communities come together, share food, and exchange news. The loss of 3 lives in such a space cuts deep, leaving behind families and neighbors who may now think twice before standing in what used to feel like the heart of their community. For expats and international viewers, it's a sobering window into one of the everyday realities of life in Vietnam. Traffic is often unpredictable, and while most days it means dodging motorbikes or dealing with congestion, sometimes, as this tragedy shows, it can mean much worse. As the investigation continues, authorities will likely examine whether driver error, vehicle failure, or other factors played a role. The hope is that lessons learned from this accident can help prevent similar tragedies in the future. But for now, Dak Nong mourns the lives lost, and many across Vietnam are reminded of how fragile safety can be on the nation's busy roads. Stories like this are tough, but they're also important. They highlight not just the news of the day, but the bigger picture: how communities live, cope, and demand change in the face of tragedy. For our second story tonight, we move from traffic safety to something much darker behind closed doors. In Ho Chi Minh City, a Taiwanese restaurant boss has been charged with running a prostitution ring for foreigners, a case that's making headlines and stirring deeper concerns. Chen Sifu, owner of KTV Richie 7 in the Him Lam residential area, has been indicted by Ho Chi Minh City Police for prostitution brokerage. Alongside him, 3 others, including a Taiwanese manager and 2 Vietnamese employees. Nguyen Thi Thuy Phuong and Nguyen Thi Thuy Kyo have also been arrested. Here's how authorities say it worked. Young female employees were recruited by the boss and instructed to provide sexual services only to foreign clients. Phuong and Kyo allegedly acted as the middlemen, introducing clients, facilitating deals. Prices reportedly ranged between VND 5 million to 8 million per session. That's about $190 to $303, depending on specifics. Then there was the raid. Police searched hotels, apartments, the restaurant, and found enough evidence to move ahead. More than 750 nitrous oxide canisters, laughing gas, and other paraphernalia were seized, pointing also to illegal trading in banned substances. For local Vietnamese, the story raises questions about law enforcement, oversight, and the safety and rights of women in the hospitality and nightlife sectors. Cases like this can damage trust in businesses and affect how neighborhoods are policed, how legal boundaries are enforced, and how vulnerable people are protected. For expats or foreigners in Vietnam, this case sends signals. There are strict laws, serious consequences, and that what might appear as legitimate business can be a cover for illegal activity. It's a reminder to be aware, to understand local laws, and to question what's seen versus what's hidden. Globally, prostitution laws, human trafficking, and the intersection with hospitality and entertainment venues are issues many countries grapple with. This is one more example of how such matters look when they come to light. The economics, the human side, and the moral legal dimension all intertwined. Legal proceedings are now underway. Chen Sifu, his associates and managers are being charged not just with prostitution brokerage, but also for the possession and trafficking of banned goods. Punishments in Vietnam for prostitution-related crimes can be severe: fines, imprisonment, revocation of business licenses. Because foreigners are involved, both in terms of clientele and management, this may draw more media attention and possibly international scrutiny. And for the women involved, there may be investigations into coercion, labor exploitation, hopefully legal or social support for them. Authorities will likely also review licensing, oversight of entertainment venues, and how such places are monitored, especially when they're catering to foreign guests. This could lead to stricter regulations or more rigorous enforcement in Ho Chi Minh City and beyond. As Vietnam balances growth, tourism, and a desire for modern hospitality, stories like this remind us that legality, ethics, and human dignity can't be sidelined. We'll keep watching as the case unfolds, what justice looks like, how the law responds, and what changes might come for businesses, through women, and for the rules that hold it all together. If you've ever been to a hospital in Vietnam, you know the sidewalks outside aren't always just for walking. Instead, they're often bustling with food stalls, vendors, and motorbikes, sometimes making it harder to reach the hospital than to find the doctor. Our next story takes us to Ho Chi Minh City, where the sidewalks around several major hospitals have been overrun by street vendors, sparking frustration, debate, and questions about how public space is managed. According to reports, sidewalks near big hospitals like Cho Rei, Nguyen Tri Phuong, and Children's Hospital 2 have turned into crowded, unofficial marketplaces. You'll find vendors selling everything from bottled water and fresh fruit to banh mi, noodles, and even plastic stools for resting while waiting for appointments. On the surface, it looks like typical Vietnamese street life, vibrant, entrepreneurial, and convenient. But in this context, it's creating real problems. For patients and visitors, sidewalks meant for walking are now blocked by stalls and motorbikes. Imagine being sick or on crutches and having to navigate a maze of noodle pots and motorbikes just to enter the hospital. Doctors and staff have voiced concerns too, saying the congestion outside can slow down emergency access and cause unnecessary risks. In short, The sidewalks are becoming more like mini markets than safe entryways to critical healthcare facilities. From the city's point of view, this isn't a new issue. Ho Chi Minh City has been campaigning for years to reclaim sidewalks from informal vendors. Officials want these spaces to be clear for pedestrians, tourists, and now especially for those seeking medical care. Yet, enforcement has been inconsistent. Vendors are often moved out 1 week, only to return the next. Why? Because demand is real, and these stalls provide cheap, fast meals and essentials to patients. Families who may be waiting all day in the hospital. And here's the cultural context. In Vietnam, hospitals aren't just medical centers. They're social spaces too. Families accompany patients, sometimes camping out for days during treatment. Street vendors outside provide affordable food and supplies, filling a need that the hospital cafeterias don't always meet. So while the vendors are technically breaking rules, they're also serving a demand that hasn't been solved in more formal ways. This makes the issue more complicated than just vendors versus the law. For locals, the problem highlights the daily tension between convenience and order, tradition and modernization. For expats or foreigners, it's a vivid reminder of how different public spaces function in Vietnam, where sidewalks are rarely just for walking, and commerce often spills into every available corner. What comes next? City authorities are promising stricter enforcement, with patrols to keep sidewalks around hospitals clear. Some officials are also discussing alternative solutions, such as designated vending areas nearby, so families can still access affordable food without blocking entrances. But whether these plans will stick remains to be seen. Vietnam's street vending culture is deeply rooted, and change doesn't happen overnight. At the heart of this story is a simple but pressing question. How can a city honor its lively street culture while also protecting the basic needs of patients and pedestrians? The answer will affect not just hospitals in Ho Chi Minh City, but the daily experience of millions who walk its sidewalks. We've talked about space outside hospitals. Now let's move inside. Our fourth story tonight looks at healthcare on a much bigger scale, as the Ministry of Health announces a national plan to better diagnose and treat the 6 million Vietnamese living with rare diseases. 6 million people. That's the number of Vietnamese living with rare diseases today. It's a staggering figure that often goes unnoticed in daily headlines. But this week, Vietnam's Ministry of Health announced a new national action plan to change that. The goal? Better support, better treatment, and better hope for those whose conditions are often overlooked. According to the ministry, Vietnam currently has around 6 million patients diagnosed with rare diseases. These are conditions that affect a very small portion of the population individually, but when added together, the impact is enormous. The problem is that rare diseases often slip through the cracks. They're harder to diagnose, more expensive to treat, and frequently leave families struggling, both emotionally and financially. A newly launched action plan aims to address these gaps. Officials say the focus will be on improving early detection, ensuring access to treatment, and boosting research and data collection. The plan also emphasizes training more medical staff to recognize rare diseases, which can sometimes take years to properly identify. For patients, that could mean faster diagnoses and fewer missteps in their care. One of the key challenges in Vietnam has been affordability. Treatments for rare diseases are often costly, and many families simply cannot shoulder the expenses. The Ministry of Health's plan calls for greater cooperation between hospitals, insurance systems, and international partners to make treatment more accessible. There's also an emphasis on developing local solutions, from producing certain medicines domestically to creating stronger patient support networks. For locals, This initiative brings a sense of hope. Families living with rare conditions often feel isolated, invisible in the larger health system. By making this a national priority, the government is signaling that their struggles are being recognized. It's also a way of saying that healthcare in Vietnam must be for everyone, not just for the majority. For expats and international viewers, the story reflects how Vietnam is modernizing its healthcare landscape. The country has already made strides in universal healthcare and in fighting infectious diseases, but rare conditions represent the next frontier, one that requires long-term investment, global partnerships, and awareness campaigns. Globally, the story also resonates. Many countries, even wealthier ones, struggle with how to handle rare diseases. The cost of treatment, the complexity of research, and the difficulty in policy making mean that patients often end up marginalized. Vietnam's decision to formally address this issue puts it in step with international efforts and shows how healthcare priorities are expanding. So what's next? The Ministry of Health will begin rolling out specific programs tied to the action plan, from improving screening processes in hospitals to launching new training for doctors. They've also hinted at broader cooperation with pharmaceutical firms and NGOs to bring resources into Vietnam. But the real test will be whether families on the ground feel the change, whether diagnosis becomes easier, treatment more affordable, and support more available. This is more than just a health statistic. It's about millions of Vietnamese living with conditions that don't always make the news, finally getting the attention they deserve. For our next story this evening, we head overseas, to Australia, where a beloved Vietnamese restaurant is closing its doors after more than 2 decades of serving the community. It's called Red Lantern, and if you've ever been in Sydney, you might already know the name. For many, it wasn't just a restaurant, it was a cultural touchstone, a place where Vietnamese food and heritage were celebrated with pride. Founded in 2002, Red Lantern was led by celebrity chef Luc Nguyen, along with his sister Pauline and brother Louis. Over the years, the restaurant built a reputation not just for great food, but for storytelling. It blended authentic Vietnamese flavors with a fine dining presentation, helping introduce Australian diners to the richness and depth of Vietnamese cuisine. And for Vietnamese living abroad, it became a reminder of home, a taste of Hanoi and Saigon right in the heart of Sydney. So why is it closing? According to the Nguyen family, the decision comes after 22 years of operation, and it's less about failure than it is about timing. Running a restaurant is tough work, and after 2 decades, the family is ready for a new chapter. Luc Nguyen himself has said he'll continue focusing on culinary projects, media work, and promoting Vietnamese food globally. But the restaurant itself will serve its final meals in October. The closure of Red Lantern has sparked an emotional response from fans. Many longtime diners have taken to social media to share memories, from first dates to family celebrations, all tied to meals inside the restaurant. It's proof that food isn't just about eating. It's about connection, community, and memory. For locals in Australia, the story is bittersweet. Red Lantern was one of the longest-running Vietnamese restaurants at its level, bringing recognition to a cuisine that was once overlooked in fine dining circles. Its success helped pave the way for other Vietnamese chefs and restaurateurs across the country. For expats and international viewers, it highlights the role food plays in cultural exchange. Vietnamese cuisine has traveled far beyond its borders, finding homes in cities across the world. Restaurants like Red Lantern didn't just serve meals. They served as ambassadors, showing how a bowl of pho or a plate of caramelized pork can carry the history, warmth, and creativity of an entire culture. Looking ahead, while the restaurant may close, its legacy continues. Luc Nguyen remains a leading figure in promoting Vietnamese cuisine globally, and the influence of Red Lantern will live on through the chefs it inspired and the diners it delighted. And who knows? the Nguyen family has hinted that while this chapter ends, new ventures could still be on the horizon. At the end of the day, the story of Red Lantern is about more than just a restaurant closing. It's about how food tells stories, builds bridges, and leaves lasting imprints on communities far from where the recipes were first created. Red Lantern may be closing, but its legacy as one of the most influential Vietnamese restaurants abroad will live on. What about you? Have you ever dined at Red Lantern in Sydney? Or do you have a favorite Vietnamese restaurant overseas that reminds you of home? Let us know in the comments. We'd love to hear your stories. And now, to close out tonight's broadcast, our sixth and final story. Dengue fever in Can Tho is expected to surge this September, and health officials are sounding the alarm. In recent months, Can Tho City in the Mekong Delta has seen dengue cases climb sharply. Between July and August alone, there were 1,843 reported cases, many of them severe. At Can Tho Children's Hospital, the number of critical dengue patients requiring intensive care has increased noticeably. From January until now, outpatient dengue cases have risen by 32% and inpatient admissions by 67% year over year. Severe cases are also up. 87 severe dengue cases have been reported, a 74% increase compared to the same period last year. Thankfully, no deaths yet, but the risk is growing. Why here and why now? The rainy season has kicked in, bringing with it ideal conditions for mosquito breeding: standing water, humidity, and warmer temperatures. These are the perfect storm for dengue transmission. In response, the Can Tho CDC has launched aggressive preventive measures. 3 proactive mosquito control campaigns are already underway. These include spraying insecticides, eliminating breeding grounds, enhancing patient monitoring, and prepping medical resources. The danger, officials warn, is the delay in treatment. Some patients arrive late, making it harder to manage the disease effectively. Early detection and treatment can make all the difference. For locals, especially families with young children, this spike is deeply concerning. Dengue is one of those illnesses where prevention and timing matter. Small steps, like eliminating stagnant water around homes, using mosquito nets or repellent, and seeing a doctor at the first signs of fever can be life-saving. For expats and international viewers, it's a reminder that tropical climates have cycles, and understanding local disease patterns is part of living. Also, rising cases strain hospitals and public health infrastructure, so awareness and cooperation are key. What's next? Authorities are scaling up surveillance, making sure clinics are ready, and urging the public to help. Clean up your yards, avoid pooling water, seek help quickly if symptoms show. And they're keeping close watch over the coming weeks, when conditions may be most favorable for outbreak. Before we wrap up, we want to ask, have you or someone you know ever had dengue? What precautions do you take in your home or neighborhood to avoid mosquito-borne diseases? Share your experiences in the comments. Others might learn something useful from you. That's it for tonight. Thanks for joining us here at Vietnam News, where East meets West. Stay safe, stay informed. We'll be back soon with more stories that matter. And now, let's hand it over to Peter for a final word.
Let us know your thoughts in the comments. We want to hear from you. I'm Peter, and from all of us here at Vietnam News, thank you for watching. Stay informed, stay safe, and we'll see you in the next report.